हेलो फ्रेंड्स, वेलकम टू माय यूट्यूब चैनल नर्सिंग करियर। नर्सिंग से संबंधित जानकारी के लिए मेरे चैनल को सब्सक्राइब करना ना भूलें। और दोस्तों, आज मैं आपके लिए पीजी स्टाफ नर्स एग्ज़ाम चंडीगढ़ और रोहतक के जो कुछ क्वेश्चन पेपर्स में से कुछ क्वेश्चंस जो हैं आपके लिए लेके आई हूँ। आई होप ये आपके लिए हेल्पफुल हो। और पीजीआई चंडीगढ़ का एग्ज़ाम फर्दर जो है एग्ज़ाम होगा, तो आई होप आपको ये वीडियो मेरी अच्छी लगे। So now let's start with my first question. Arterial septal defect occurs due to the persistence of foramen ovale, ductus arteriosus, ductus venosus, and a mitral valve. And its answer is a foramen ovale. And second question is the cells that are responsible for the production of antibodies are red blood cells, platelets, plasma, and a white blood cells. And its answer is a white blood cells. Question number third. The strength of savlon for cleansing of wound is 1:10, 1:100, 1:1000, 1:10,000. And its answer is a 1:10. Question number fourth. Dash is caused by the fungus. And its answer is a malaria, athlete foot, filariasis, and a typhus. And its answer is a athlete foot. Question number fifth. The first sign of digoxin toxicity is dizziness, nausea, vomiting, nausea, headache, and anorexia. And its answer is anorexia. Anorexia means loss of appetite. Question number 6. The normal blood urea level is 40 to 60 mg, 20 to 40 mg, 10 to 20 mg, and last one is 80 to 120 mg. And its answer is 20 to 40 mg. Question number 7. Dash is the immunity get by the body after the first attack of disease, and its options are natural immunity, passive immunity, artificial immunity, and acquired immunity. And its answer is acquired immunity. Question number 8. The blood group contain no antibody, and its options are A, B, O, and AB. And its answer is AB. Question number 9. When the umbilical cord lies in the front of presenting part and the membrane are intact is known as cord prolapse, cord presentation, cord pulsation, and cord delivery. And its answer is a cord presentation. Question number 10. The vaccine used for the prevention of cervical cancer is HPV, IgG, hepatitis B, and a BCG. And its answer is a HPV. Question number 11. Which activity would the nurse encourage the client to avoid when there is a risk of increased ICP? Deep breathing, turning, cuffing, and a passive range of motion exercises. And its answer is a cuffing. Question number 12. The ratio of a cardiac compression and a artificial breathing is 30:2, 12:3, 60:6, and 15:2. And its answer is a 30:2. Question number 13. The oncotic pressure is defined as osmotic pressure by electrolytes in the cell, osmotic pressure by plasma colloid in solution, force within a fluid compartment, and a force outside the fluid compartment. And its answer is the osmotic pressure caused by the plasma colloid in solution. Question number 14. Which of layer of artery contains smooth muscles? And its options are tunica interna, tunica alba, tunica media, tunica externa. And its answer is a tunica media. Question number 15. The main product of protein metabolism is iodine, urea, carbohydrate, and glycogen. And its answer is a urea. Question number 16. The amputation of foot is indicated in osteomalacia, gangrene, fracture, and a gout. And its answer is a gangrene. Question number 17. Pap smear used to diagnose for which disease? And its options are cancer of ovary, cancer of uterus, cancer of cervix, and a breast cancer. And its answer is a cancer of cervix. Question number 18th. SLE is an example of systemic lupus erythematosus is an example of communicable disease, autoimmune disease, hemolytic disease, and a cancerous disease. And its answer is a autoimmune disease. Question number 19th. The term OMA means OMA, cyst, new growth, opening an organ, and its mean is new growth. Question number 20. The reduction of bone density leading increased susceptibility to fracture is osteomalacia, Paget disease, osteoarthritis, and osteoporosis. And its answer is osteoporosis. Question number 21. One of the following is an antiplatelets drug, and its options are digoxin, aspirin, streptokinase, and dobutamine. And its answer is aspirin. Aspirin is an antiplatelet drug. Question number 22. The lifespan of the fetal abscess is 120 days, 5 to 7 days, 80 days, and 100 days. And its answer is 80 days. Question number 23rd. What is the meaning of otitis media? Inflammation of tonsil, inflammation of sinus cavity, inflammation of middle ear, and inflammation of kidneys. And its answer is inflammation of the middle ear. Otitis media means the inflammation of middle ear. Question number 24th. Which of the following complications is associated with the tracheostomy? And its options are decreased cardiac output, damage to laryngeal nerve, and pneumothorax and ARDS. And its answer is damage to the laryngeal nerve. Question number 25th. Which of the following is the main clinical feature of pyloric stenosis? And its options are irritability, weight loss, projectile vomiting, and constipation. And its answer is projectile vomiting. In pyloric stenosis, its main clinical symptom is a projectile vomiting. थैंक यू गाइस, आई होप आपको मेरी वीडियो अच्छी लगी हो और नॉलेजेबल लगी।